Everyone. Thanks for joining the Hygiene Hub. We're on season 2, episode 6, which is super crazy. And I am excited. We've got Mr. Dr. Doug Voiers and Miss Bethany Anderson from Aura Smile in Cleveland, Ohio. So thanks for joining us today, guys.
Hey, great to be here.
Awesome. So, Dr. Voyers, what I know about you and your team is that you really have passion around destructive malocclusion in your practice. So, tonight we really want to hear from you and your hygienist on how you make it so seamless in your practice, because we know North American Dental Group just did a really great thing with rolling out Project 23 and scanner technology into our practices. So, we were hoping to hear from the both of you tonight.
Absolutely.
Awesome. So that's you in my perspective, but I would love to hear from you and Bethany about yourself and your practice and really the partnership that you have with your hygienist on a day-to-day basis.
Yeah, so the first thing I'd like to say is that I'm a strong believer that the hygienist and the doctor need to work together in a symbiotic relationship, and they've got to be team players working together. I kind of look upon my hygienist sort of as a physician would look upon their physician assistant. And they're there to leverage our time. They're there to develop the relationships with the patients. Our hygienist, I want my hygienist to be intelligent, to be independent minded, and to be able to be a de facto doctor in the room when I'm not there. And that is the way our hygienists are. I have tremendous confidence in them. I train them up so that we have like a hive mind, so that when I go in there, the hygienists are 1 and 2 steps ahead of me. I want the hygienist to prompt me every step along the way. And I think most of the hygienists are trained well enough to do that. They're capable enough. We doctors have just got to give them a little bit of free rein, give them their space, and allow them the opportunity to do that. And that way we can work together. And that's kind of how the destructive malocclusion came of being. I've been doing clear liners for 17 years. And I developed the destructive malocclusion protocol about 5 years ago when I felt like I was sort of reaching a brick wall. I wasn't seeming to get through to the patients like I really wanted to. And so I came up with a process that is worked in a seamless fashion with the hygienist. It's sort of a 4 to 5 step process. And the hygienists actually lead the way. I come in sort of in the middle of the process. The hygienists initiate the process, and it just works. When we do it together, it is a thing of beauty. It works great. The patients feel very confident because they're hearing it from the hygienist, and then they're hearing it from me, and then they're hearing it from the hygienist again. And it becomes believable. It becomes valid. And it really sends the kind of message to the patients that we want to send. So that's a little bit about how I feel, how strongly I feel about the role that the hygienists play in our practice.
Yeah, it sounds like consistency and systems and processes, right? You know, we'll fall to the level of systems and processes that we have in the practice and in anything that we're trying to accomplish.
Right. Yeah, and so and Bethany, would you say that you've seen a difference? Like we started 2017, I think we rolled out destructive malocclusion.
Yeah.
In 2018, we really hit the ground running with it. And would you say you've seen a difference in the number of cases we've done?
I think so.
Yeah.
The past several years, yes, I do think there's definitely been an increase in more acceptance lately, for sure. Probably 3-4 years.
So I hear that you guys had intentions like early on, but it took you a while to understand that you needed to develop like a seamless process in the practice. So what was kind of like that breaking point that you decided, okay, we need to do something differently if we want to get a different result? Like what was that aha moment?
That is a great question. And here's just to back up, and I think a lot of hygienists will be able to relate to this. Doctors will, but hygienists will as well. Think about this. Think of how many times you have worked with a patient to develop and to pre-diagnose, diagnose, and treat periodontal disease. and you're going through, you're doing everything you possibly can, and you know that the patient is complying at home, you know you're doing your job, you're following up, but yet you notice over time that things begin to break down. They're starting to develop perhaps some additional inflammation in the lower anterior teeth. They're starting to develop some recession, and you're starting to see some root cavities develop. And you're thinking, my gosh, I'm doing everything possible. And in addition, the hygienists begin to see other things happen. You know, it's interesting in dentistry. Our goal is to develop long-term relationships with patients, right? It's unlike the specialists who see them once or twice or whatever it takes, and then they're gone. We're seeing these patients over 5, 10, 15 years, and I've been in practice since 1985. And I began to see very disturbing trends. I began to see problems with perio not working like we thought. I began to see dental restorations that I know I put in place the right way and the right technique. And then the hygienist would see some of these restorations begin to break down, and we couldn't find the cause. We would start to see tooth chipping, enamel chipping, all kind of things going on. That was very frustrating, even though we're doing our level best. And I know Bethany would see this too in hygiene. We would be like discussing these problems, like what's going on in the patient's mouth? We can't figure it out. And what's the go-to? What did we use to the go-to when we would see people grind and clench it?
Night guard.
That was our go-to.
Yeah.
I mean, yeah, that was a Band-Aid. And these guys who were taking impressions in hygiene, we got them to take impressions and to work on placement of the occlusal guards. So that was the standard go-to. And I'm sure hygienists listening to this can relate. They understand what I'm talking about. But it became increasingly frustrating to the point where I had to step back and take a look at 30 to 40,000 feet and start to think, with my background in cosmetic and reconstructive dentistry, with my background in CEREC dentistry and restorative dentistry, and then my background and experience with clear aligners for 17 years, there's got to be a better way to do this. So first of all, it had to be, okay, we're missing something on the diagnostic side, and we're missing something on the treatment side. What are we missing? Well, think of it, hygienists. What are you taught in school? There's 2 pathologies that you're taught in school. It's periodontal disease and dental caries, right? And there's basically, I mean, in school, were you taught much about occlusion or malocclusion in your formal education?
No, I don't believe so.
I mean, maybe a little bit, they hit on it.
Not a lot, though.
Not a lot, yeah. And in dental school, we're taught about it, but we're really not taught how to consistently diagnose, and we're not taught how to treat it consistently. So it's this mysterious, ethereal thing that we throw the mouth guards at and we hope for the best. Well, that's where I began to see the flaw, the fly in the ointment. I said, we're diagnosing and treating perio thoroughly, comprehensively. We're diagnosing and treating dental caries, and we pride ourselves in being a comprehensive dental practice. Our new patient indoctrination process is exceedingly thorough, okay? But we were really missing one thing, and that was a static method for diagnosing malocclusion, and then a method for treating it, or at least mitigating the damage that malocclusion was causing. And so all of these different problems that we were seeing, gingival recession, enamel breakdown, cusp wear, TMJ problems, myofascial pain, gingival inflammation, dental work starting to break apart. These are the signs and symptoms of destructive malocclusion. And there's a better way to treat it than the occlusal guard, because let's face it, with the occlusal guard, the opposing dentition is going to continue to shift over time, and they're going to occur physiologic drift, which is a normal human process that occurs year after year. Physiologic drift is so dramatic, it can occur up to 0.7 millimeters per arch per year.
Yeah.
So you think you're seeing patients 5 to 10 years, how much movement that is in the arch.
Yeah.
Well, the occlusal guard is not going to be able to take care of that. So with this dental collapse, the mitigating treatment is to reverse this process, because are losing vertical dimension, they're losing tooth structure, they're losing alveolar bone, reversing this process. So one of the things I began to observe is that in my cases where we did provide clear aligner therapy for whatever reason, whether it was cosmetic dentistry or whatever the reason, we began to see conditions that were more stable than other conditions. I began to observe this. I said, my gosh, this is how we can seriously mitigate malocclusion, which occurs so often in patients between the ages of 18 and 75, that we've got to come up with a way to diagnose it, just the way we diagnose periodontal disease, and we've got to come up with a way to treat it in a consistent fashion that stops this destructive process in the mouth. And that really is how my destructive malocclusion diagnostic tool and treatment protocol utilizing clear aligners, that's the evolution of it. That's how it came to be.
Mm-hmm. Yeah, and I hear it in your voice that it's like the purpose of your practice, right? Like you guys are on a mission to really solve a big problem, right? And I think when you have that vision, the commitment level is just increasingly high, because you guys are all committed to really educating and treating that destructive malocclusion. So it's super cool. I would like to hear from you guys. You said that you had to figure out a system to diagnose and you had to figure out the system to treat. So I'd love to kind of get into very briefly, the process that you guys do and how do you partner together and how do you identify when maybe the process is a little bit broken at the end of the week and provide each other that transparency to keep you both on track?
So I think Bethany can start out talking about the process because it does start in hygiene. Like I said, I come in between. So you can describe how we started.
So when I sit my patients down, I start talking to them. I will usually start with some photos for doctor. So I'll take some IO photos. There's 5 specific photos that he likes. Get them up on screen as I'm taking them. I usually have the patient sitting up so they can see the screen as I'm taking them. And just describing what I'm seeing, if there's premature chipping and wear, and if there's bone loss and recession, I get those on the screen. I'm like, oh, your teeth are thinning and they're rotating. And then I talk, have you had braces? Have you had invisible ortho? Because I'm definitely seeing that your teeth are pretty much wearing and aging faster than they are. And they don't usually realize it until we put it up on screen to show them. And I say, well, I am seeing these different signs. And when doctor comes in, I'm going to go ahead and have him do an evaluation of your bite and your occlusion, because I think that you definitely have some signs that need to be taken care of before that they get worse and progress where we can't fix them.
Mm-hmm.
Yeah, so Bethany was talking about really the co-discovery process. Mm-hmm. And so it starts with, like she says, she'll sit the patient up. When I come in for the exam, the patient a lot of times will be sitting up, and those intraoral camera images will be right on screen. And my hygienists do a tremendous job. They nail it. There's a process that we developed that everyone in Project 23 has. So there's a form that I developed that shows them this process, shows the exact images. And when I walk in, what the hygienist does is Bethany will give me a full report. She'll start out, she'll saying, okay, today we did periodontal charting, we did radiographs, evaluated, I want you to look at this tooth may have some dental caries. We've got a few perio pockets here and there. So she gives me this cascade of report when I come in. And then at the very end, she says, and I would also like you to take a look, Dr. Voiers, on the images on the screen. What we're seeing is this, and this, okay? And then, so what that does is that leads me into the destructive malocclusion form, which the hygienist will always have up on the back screen, the computer screen, so that when we just roll right into it, just like a team, I start going through and verbally reporting on all of the findings. It's just, all you have to do is just look at the destructive malocclusion form, and it leads you right through from top to bottom. And then when we get to the end of it, then it's sort of my turn, it's the doctor's turn to then talk and begin to talk at that situation. I move my body around to the patient and we begin to engage. So the patient is now activated, and now we engage the patient even further to a deeper level, and we begin to explain the causative factors And we begin to then get into, and by the way, it's important to not jump to solutions prior to that. Like Bethany, would you say, do the patients ask you when you start talking, do they ask you what to do, or are they delayed on that typically?
Some do, not all of them
Yeah.
though, but some do definitely ask.
That's what the solution
Yes,
is.
yeah.
Yeah. But we really try to not jump into solutions too quickly. We really want the patients to have a much deeper understanding of what's occurring and why it's occurring. It's not just the what, but we have to tell them, look, this is physiologic drift. It happens to everyone. It's going to continue to happen unless we intervene. And so then I can come in and say, look, what we do is you've got an unbalanced situation that's breaking down the bone, breaking down the tissue, and breaking down the hard structures of your teeth, the tooth enamel, and even your dental work. This isn't going to stop. It's only going to get worse until we intervene and sort of reverse this aging process in your mouth. And we do that through the use of clear aligners that can gently, slowly, over a period of time, aligner by aligner, move your teeth back into the position that they were years ago. And now your bite can be balanced again, so this destructive process stops. And then I also follow up and say, and also there are opportunities there to talk to patients. Maybe they may need veneers or bonding afterwards, or maybe they may need other dental work to be done. I just saw a patient literally 2 minutes before I came onto this interview. I finished up with a hygiene exam, and one of my hygienists and I did this exact same thing. And the patient brought up to me a crack in her veneer in tooth number 9. She wanted me to fix it. And I said, I cannot fix this until we straighten your teeth, because if I put a veneer in that environment, it's not going to work. And so I don't know what transpired, but that patient is going to go up and talk to our front desk, and probably talking right now about straightening the teeth. And then after that, we can go in and do the restorative dentistry. And I think it's important for the hygienist to be able to be on the same page, because we can't be making treatment recommendations that are going to be fraught with peril and set up for failure in the future.
Yeah.
So that's a big part.
Definitely. And you know what I hear is, A, you have to be consistent, right? And B, visuals are super important in the process. And that transfer of knowledge from the hygienist to the doctor is probably the biggest aspect in the diagnosis portion of it.
You got that right.
You know, I love what you said. We need them to understand the problem before we get to the solution. And that's really always been my rule when I'm communicating with patients is problem, solution, and consequences. Like, don't move on until the next one until they understand the problem, then the solution, and then the consequence. And it sounds like that's kind of the rule of thumb at your practice.
Yeah, that's absolutely true. And it's critical that also, and the hygienists know this, when the doctor leaves, no matter what I explain to the patients, the patient is going to immediately turn to the hygienist, and there come a whole nother set of questions that they're afraid to approach me with.
And he's gone. He ran.
And I'm gone.
So
I have faith in my hygienist because they're trained in this. They know what I know. So every question the patient asks, the hygienists are going to be able to do it. And I will say one other thing. You know, we doctors are busy, and you hygienists, you know what it's like. The doc comes in to do the exams, and we're busy, and sometimes we're a little bit preoccupied with other things. What Bethany does almost better than anybody I've ever seen is she does not let me go. She will not let me leave the room. She will not let me move on to anything else until we cross the T's and dot the I. I mean, it's to the letter. If I don't do a destructive malocclusion evaluation when I'm supposed to for that particular patient, she won't let me leave the room. She's like, okay, doc.
it sounds like you guys hold each other accountable to the process.
Yes, it's important.
We're all
Dentistry's tough. It's a tough day we go through, some worse than others. And it's important that the hygienist really hold our feet to the fire at times.
Yeah. And so let me ask you, you know, in this diagnosis discussion and the process and staying consistent and knowing that you guys really wanted to speak your truth on what destructive malocclusion was doing for their overall health, you know, oftentimes when we go from doing one thing in a practice to doing another, like that fear of change is really real, right? And we start to tell ourselves all of the worst case scenarios of that we're going to start to upset the patients because it's nothing they've ever heard before. So I'd love to understand, like, if you're how your patients received this news when you really started to be consistent, and like how did you overcome any of those fears that your practice might have had?
So here's the crazy thing about that.
Mm-hmm.
What's in our head is not the same thing that's in the patient's head. You know what the patients are thinking? The patients watch TV, they follow up on the latest advancements in medicine and everything else in society.
Yeah.
And if we are not changing, if we're not evolving, they're thinking, what's wrong?
Mm-hmm.
They have an expectation for us in the medical profession, the dental profession, to continually evolve and advance and better ourselves for their benefit.
Yeah.
And so when I approach patients, when Bethany and I approach patients, it's amazing how often, even if the patient, the patient say, oh, I've got 2 kids in braces right now, I can't do anything, or I just bought a new house or whatever it is, that's fine. We're not going anywhere. But the patients, it's amazing how often they thank me and they thank Bethany. They're very thankful that we're bringing this up. They have a right to know what's going on in their mouth, and they appreciate the fact that we're offering them a solution to problems that are very evident. I mean, you can't turn away. You look at the wear on their teeth, you look at the exposed roots, you see the destruction that's going on, okay? And it's very evident. They can't deny it. It's in their mouth. So it's our job to bring it up. It's our job to offer them solutions because we're in this for the long haul. Well, I always tell my patients, look, people are living longer and everyone wants to keep their teeth. How many 90-plus-year-olds do you see in your practice anymore? It's amazing. So we have to look at the mouth in a different way than we used to. It's a different paradigm today. So I tell patients, look, it's my job to help you keep your teeth the rest of your life. And having a balanced, level, harmonious occlusal scheme in your mouth is a part of that.
Mm-hmm.
I don't know if we've ever had a patient give us a hard time about it. I mean, maybe they can't do it for cost
Right.
reasons or whatever, but I mean, would you say?
I don't think so. Not really. And they're never mean about it. They're never like, why has somebody else never told me? They're usually like, oh, thank you. Nobody has told me. And seeing these pictures, I'm aware and I'm thankful that you've gone over this with me.
Yeah. And it's the thing, right? Like they don't know what they don't know. And, I think when they do know and they do accept the treatment, it changes their lives, it changes their health, their oral health, which is their systemic health. And it probably provides a level of confidence that maybe they didn't have prior to, clear aligner therapy. So I would love to understand, from the aspect of like the patient's point of view, like how has it impacted their health? And do you have like any stories of how it like impacted someone's, confidence or just their overall life?
I know I've had patients that have complained about TMJ and always being sore in their jaws. And I've had multiple of them that have finished the clear aligner and they tell me the pain's gone. And it's one of the best things they could have ever done to just go through that in less than a year. And the pain is gone. And it's amazing to be able to hear that from them.
Yeah, the patients, aside from what we like to think of, and this was my approach, and this is the approach that most dentists use throughout the country using clear aligner therapy, is the cosmetic approach, right? And that's all well and good, but I tell patients, look, I'm approaching this because this is a functional problem you have, and I will say now in the end, however, it's going to look great. And what we do here in the practice is I do a little bit of bonding at no extra charge at the very end. Okay, we call it our contour and finish appointment prior to getting the scans for their final nighttime retainers, so that in the end it's going to look beautiful. And I tell them it's going to look great, but I back up and I say my concern for you is the functional approach. Well, in the very end, guess what they're really the happiest about?
Right.
How great it looks.
Yeah.
And
it's a win-win.
So it's kind of hard to convince them to do it for those reasons to begin with, and I don't advocate doing it because it's tough to do. But in the end, that's what they love more than anything.
Yeah, totally.
Headaches, I think people too, not having headaches anymore after having it done. I mean, I had a lot of them that tell me that also.
Yeah, it really does transform their life from the inside out, I guess you would say.
Well, and if you think about it, Kelly, if, we take a great deal of pride in being a comprehensive dental office, right? So we develop lifetime oral health care plans for our patients, and we take a tremendous amount of pride in that. If your goal is to be as comprehensive as you possibly can in dentistry, if we're missing the diagnosis and treatment for destructive malocclusion, it's really not possible to be delivering comprehensive care. So if our goal and our objective here at North American Dental Group is to deliver best-in-class care, this has to be integrated into the practice. And it is the most least understood, most overlooked component of dentistry. We know a lot about dental caries and how to treat it effectively. We know how to treat periodontal disease. The hygienists are very well trained and very well versed in that, and they know how to talk about it. This has to be done. Okay, the hygienist, if we really want to take pride in what we're doing for our patients, this is the missing link, the missing third leg of the stool that really needs to be incorporated into the practice for us to be truly effective for our patients on a comprehensive manner.
Let me ask you, how has it affected your perio program? Like, like.
I had people that wouldn't floss because they say that they can't floss because it's too hard. And after they actually are going through it, they're flossing. And I mean, that makes me happy. Compliant. They are way more compliant.
Yeah.
And I mean, those lower interiors are a pain, to scale a lot when they're very crowded and overlapped. And it makes it so much easier for them and obviously for me to clean that area after they go through it.
Makes your life easier, huh?
Yeah.
Awesome. Well, let's wrap up. And, I think my last thing is we have a lot of practices out there that are new to digital technology. They're new to, clear aligner therapy, and they're just getting started. So if they had one thing to take away from you guys at the end of this, what would that advice be that you would leave them?
Jump right in.
About the 3D scan, like
everything that we're doing with clear aligners. I mean, no reason to be afraid of it.
Yeah, I definitely don't think there isn't a reason to be afraid of it. People can tell you no, but your job is to, give them the best in class care. And if it's something obviously that they need for the longevity of their teeth, that's our job. That's our profession to make sure that they know that.
Stay consistent, speak your truth, and detach from the outcome of what comes from it. Yeah.
They sense that. And for the hygienists out there, what I would just say is, I think it's important that you can't do this on your own. Okay. You can't do it independently. You may have all the best intentions. You may know exactly what you're doing with the approach with the patients and pre-diagnosis and so forth, but you have to work with the doctors. So one bit of advice I would give you is get together with your doctors, make sure that you're all on the same page. I don't care if you have to rehearse it, have a team meeting and rehearse these things. It doesn't matter how you do it, but work with your doctors. And I will say, I know doctors, I've been teaching doctors for 20 years. And doctors can be a little bit hesitant. In some ways, the hygienists are a little bit more forthright than doctors are. And I'm not exactly sure why that is, but I think you need to take your docs by the hand and help work together with them and let them know that you're going to set them up. And I think if you set the doctors up properly, if you do what Bethany described and what we have in our kits that are disseminated with all the information and the handbook and so forth, and the modules that we have now in our learning portal, you can set the doctors up and they can take it from there. And it becomes much easier for the doctors. And so they can overcome their fears, being confident that they have a hygienist that's going to set them up properly. And that really, I think, is really where it I think can be the most effective thing that you can possibly do working with your doctor.
Yep. Just lead through it. Well, I really enjoyed the conversation, and I love to hear the passion that your practice has, and really kind of solving a missing piece, in care a lot of times. And, your guys' education around your practice, is about to influence the entire company, and I think it even goes outside of that, because what we know in our company is going to go to other practices, and it really just is that ripple effect, and it really will change lives. So just kudos to the work that you guys do and the wealth of knowledge that you've shared, throughout our company.
Well, thank you. And I would encourage any hygienist that has a question, you can email me. Feel free to send me messages if you're up against a roadblock somewhere, if you feel you're faltering in a certain area, you need some encouragement. I will be there and I respond. Kelly knows I respond very readily to emails, so I don't mind it at all. I enjoy it.
Awesome. Well, have a great day, everyone, and thanks for joining the Hub.
Thank you. It's good to be here.